I've received some concerning comments lately from women who are unwilling to participate in routine screening mammograms because they've heard from one person or another that the mammogram itself causes cancer. I am absolutely an advocate for doing your own research, but you have to make sure that it comes from a reputable source. 1 in 8 women will be diagnosed with breast cancer in their lifetime. This equates to a 13% lifetime risk of developing breast cancer. It is the second leading cause of death in women. The good news is, when this cancer is caught early, the 5-year survival rate is approaching 99%. Mammograms are performed with radiation, that's true. But the typical radiation exposure from a screening mammogram is about 0.4 millisieverts. This is equivalent to just existing in the world for 7 weeks or taking a flight from New York to Chicago one way. If you really break down the data, the cumulative risk of developing breast cancer if you perform annual screening mammograms from age 40 to 80 is associated with a lifetime attributable risk of 20 to 25 cases per 100,000 women screened. This equates to a 0.025% increased risk of breast cancer from mammograms alone. If you compare this to a 13% risk of breast cancer just from being a woman, it's really a no-brainer. There are several task forces out there who have different recommendations on breast cancer screening. The U.S. Preventative Task Force recommends that women begin annual screening at age 40 and continue until age 74 to decrease the risk of dying from breast cancer. The American College of Radiology recommends beginning breast cancer screening at age 40, but beginning a conversation with your primary care doctor at age 25 to determine whether you're at increased risk for breast cancer. They do recommend earlier and more intensive screening for patients that are at high risk. The American Cancer Society recommends optional screening between age 40 and 44, annual screening from age 45 to age 54, and then optional every other year mammograms from 55 and older. Higher risk individuals may require a breast MRI and a mammogram annually beginning at age 30. How do you know if you're at high risk? Well, high risk individuals would be a known carrier of the BRCA1 or 2 mutation, someone with a first-degree relative with a BRCA1 or 2 mutation, several congenital syndromes such as Li-Fraumeni or Cowden syndrome, or anyone who has had chest radiation before the age of 30. So here are the important takeaways. Screening can detect cancer earlier. Regular screening can reduce deaths from cancer. And early detection just means you have more options for treatment. We should also focus on preventing diseases rather than treating them. Limit alcohol consumption, maintain a healthy weight, avoid smoking, and increase physical activity. So if you limit your modifiable risk factors, perform routine self-exams, and perform the recommended surveillance, you can hopefully live a very long and healthy life.